Hello, everyone. I'm Dr. Elena Morales, a board-certified urologist specializing in male sexual health and hormonal restoration. For over 20 years, I've listened to men from every background, executives, construction workers, athletes, and retirees, come into my office with the same quiet frustration. They sit across from me, lower their voices, and say, "Doc, something's not the same. I wake up tired, my energy's low, and, well, down there, things just don't work like they used to." They say it with embarrassment, as if admitting a personal failure, when in reality, what they're experiencing is one of the most common and misunderstood health issues men face after 40. The truth is, it's not always about age, stress, or even lifestyle. It's about what your body no longer produces or absorbs the way it once did. You see, your body is not a machine that simply wears out. It's a living, chemical system that depends on balance, especially when it comes to blood flow, hormone production, and nerve sensitivity. Most men think erections are purely about testosterone or desire. But in medical reality, an erection is a vascular event. It's about blood. Strong, steady, oxygen-rich blood moving freely through relaxed arteries. And that process depends heavily on two vitamins that almost no one talks about. These vitamins aren't exotic. They aren't sold behind pharmacy counters. In fact, you probably walk by them every time you visit a supermarket. Yet without them, your arteries stiffen, your hormones misfire, and your nerves lose the ability to trigger that healthy response your body once produced so easily. When men come to me saying, "I've tried everything and nothing works," I always start by asking what they're taking daily. 9 out of 10 times they're on magnesium, zinc, or a multivitamin, yet still deficient in the two nutrients that matter most for vascular performance. It's not their fault. Modern diets, processed foods, indoor lifestyles, and chronic stress strip away these essentials faster than most realize. The result? A silent deficiency that starves your circulation system. The vessels that carry life-giving blood to the heart, brain, and yes, the penis, begin to lose elasticity. Over time, that stiffness means weaker blood flow, slower response, and reduced firmness. Here's where it gets interesting. Several recent medical studies have compared these vitamins' effects on endothelial function, the lining of your blood vessels, to those of prescription drugs. The results are astonishing. In controlled groups, men who corrected these deficiencies experienced better nitric oxide production and vascular flexibility than those relying on short-term chemical stimulants. In plain terms, their bodies started working again naturally without forcing it. That's what makes these two vitamins so remarkable. They don't manipulate your system like a blue pill does. They rebuild it. They nourish the pathways your body was designed to use. They remind your arteries how to relax and expand. They help your nerves communicate efficiently, and they stabilize the hormones that control drive, energy, and mood. What happens next surprises almost every man I treat. Within weeks, they notice subtle but powerful changes. They sleep deeper. They wake up with more energy. Their confidence quietly returns. Morning erections, the kind they thought were gone forever, begin to come back, not because of magic, but because their body is finally receiving the chemistry it needs to perform. I tell them, this isn't a miracle. This is medicine working with your biology, not against it. I understand the skepticism. After all, the blue pill has become a symbol of quick fixes and instant results. But as a physician, I can tell you this. Quick fixes come with costs. Headaches, heart strain, dependency, and a false sense of security. When you rely on chemistry that forces the body, you silence the signal but never fix the cause. That's why so many men end up chasing higher doses over time. Their system becomes numb. Their body forgets how to perform on its own. Meanwhile, those who restore these key vitamins regain something more valuable than performance. They regain control. They stop feeling broken. They start feeling alive again. The truth I wish more men understood is that your body wants to heal. It's constantly repairing, building, and recalibrating. But it can only do that if you give it the right materials. These vitamins are like architectural blueprints for blood flow and hormonal health. Without them, the structure collapses from within. With them, everything begins to align, circulation, nerve function, testosterone, and even mental clarity. I've seen patients reduce blood pressure medication, regain stamina, and rediscover intimacy simply by correcting these two deficiencies. When you realize that your issue isn't weakness but chemistry, everything changes. You stop blaming yourself, and you start working with your body instead of fighting it. That's the foundation of real, lasting performance. So before you spend another dollar chasing temporary fixes, ask yourself this. Have you ever truly nourished your body for what it needs to function as a man? Because in my experience, the answer is almost always no. Most men don't even know these vitamins exist in the right balance, let alone how to take them. And that's exactly why I created this series, to show you how to rebuild naturally, safely, and effectively. In the next part, I'll reveal exactly what these two vitamins are, how they work together, and why taking them at night turns your body into a natural restoration system. Trust me, once you understand the science, you'll never look at performance issues the same way again. Now that we've opened the curtain on the real reason behind declining male performance, let's talk about the science, but in a way that actually makes sense. You don't need a medical degree to understand your own body. You just need the right explanation. So, let's begin with what truly happens during an erection. It's not just about desire or hormones. It's a carefully coordinated event between your brain, your nerves, and your blood vessels. When your mind is stimulated, it sends a signal through the spinal cord to the pelvic region. That message tells your arteries to expand, your veins to compress, and your body to direct blood exactly where it's needed. At the heart of that process is one crucial molecule, nitric oxide. It's the natural chemical that says, open up. Without nitric oxide, even the strongest desire won't lead to a strong response. When you're young and healthy, nitric oxide is released easily. Your arteries are soft, your blood flow is quick, and your nerves react instantly. But as the years pass, stress, inflammation, and nutrient deficiencies quietly reduce your body's ability to make it. By the time most men notice the problem, it's already been developing for years. You might still have the same hormones, but the signals no longer travel efficiently. It's like having a full tank of gas but a clogged fuel line. And that's where the two forgotten vitamins come in, the ones that outperform any chemical pill because they restore what's missing instead of replacing it. The first is vitamin D3, sometimes called the sunlight vitamin. It's not just for bones. It's a hormone precursor that affects more than 2,000 functions in the male body. Low D3 levels have been directly linked to poor testosterone production, low energy, and weaker erections.
Why?
Because vitamin D3 controls how your body processes calcium and how your blood vessels respond to nitric oxide. Without enough D3, your arteries become rigid, your blood pressure rises, and blood has a harder time reaching the pelvic area. In studies conducted on men over 40, those with higher vitamin D3 levels consistently showed stronger testosterone profiles, better vascular health, and improved erectile response. It's not an exaggeration, it's biochemistry. But here's the part most people miss. Vitamin D3 can't work properly alone. It's like having the key to an engine but no ignition. That's where vitamin K2 steps in. Most people have never heard of K2 because it's not talked about in mainstream nutrition, yet it's one of the most powerful protectors of arterial health we know. K2's main job is to direct calcium where it belongs, to your bones and teeth, and prevent it from clogging your arteries. Without K2, all the calcium you get from food or supplements can end up in your blood vessels, hardening them like old pipes. And once that happens, even perfect nitric oxide production won't help because the pathways are blocked. When you combine D3 and K2, something remarkable happens. Vitamin D increases calcium absorption, and vitamin K2 makes sure that calcium ends up in the right place. Together, they protect and even reverse arterial stiffness, allowing your blood vessels to stay flexible and responsive. And flexibility is the foundation of every healthy erection. A flexible artery can open wider, carry more blood, and respond faster to signals from your brain. Think of it like upgrading your plumbing system. Suddenly, pressure and flow return to normal, and the system works as it was designed to. This combination also benefits testosterone indirectly. D3 supports the Leydig cells in the testes, which are responsible for producing testosterone. When your D3 levels rise, those cells begin functioning more efficiently, leading to natural hormonal balance. And with K2 keeping your arteries and veins clear, the hormones can circulate properly through the bloodstream. It's a synergy that modern medicine often overlooks because it doesn't fit the quick-fix model. But as a doctor who treats real men every day, I can tell you, this combination has changed lives. Another fascinating piece of the puzzle is inflammation. Chronic inflammation silently damages the endothelium, the inner lining of your blood vessels. When that lining becomes inflamed, it loses its ability to release nitric oxide effectively. Studies show that vitamin D3, combined with K2, reduces inflammatory markers like CRP and improves endothelial function. In plain language, it calms the walls of your arteries, allowing them to behave young again. That's why many of my patients don't just notice better sexual function, they notice clearer thinking, improved stamina, and deeper sleep. Once circulation improves, the entire body benefits. Men often ask me, "Doctor, if it's that simple, why haven't I heard this before?" And I tell them, because no one makes billions of dollars selling vitamins. But in the scientific world, the evidence has been there for decades. Research from the University of Milan, Harvard, and several cardiovascular institutes confirms that restoring D3 and K2 together can significantly improve vascular elasticity, oxygen delivery, and hormonal stability, all the key components of male performance. What makes this duo special is that it doesn't force your body, it teaches it. Blue pills override natural signaling, flooding your system with chemicals that push your arteries open whether they're ready or not. D3 and K2 work differently. They repair the system that allows your body to respond on its own. It's like retraining the mechanism that used to fire automatically when you were 25. That's why I call it the quiet fix. It doesn't give you a sudden shock. It gives you restoration. Over days and weeks, your circulation improves, your energy rises, and your confidence comes back naturally, without the crash or dependency. If you've been relying on short-term solutions, it's time to think differently. Your body isn't failing, it's waiting for the right chemistry to return. By feeding it the nutrients that control nitric oxide, hormone regulation, and vascular health, you give yourself the chance to experience what natural vitality truly feels like again. In the next part, I'll show you exactly how and when to take these vitamins to unlock their full effect, because timing and absorption make all the difference between small progress and a life-changing result. Now that you understand how these two vitamins work, let's talk about something most men overlook entirely: timing. You could be taking the best supplement in the world, but if you take it at the wrong time, your body won't use it properly. This is one of the main reasons so many men tell me, "Doctor, I've been taking vitamins for months and nothing's changing." The truth is, the way you take them is just as important as what you take. Our bodies have internal clocks that control everything: hormone release, digestion, blood flow, and even nutrient absorption. And when you understand those rhythms, you can use them to your advantage. The body's natural repair cycle begins at night. While you sleep, your brain cleans itself, your cells rebuild, and your testosterone quietly reaches its peak levels. This is also when your body absorbs fat-soluble vitamins like D3 and K2 most efficiently. During the day, stress hormones like cortisol dominate, keeping your blood pressure high and your metabolism focused on survival and alertness. But when night falls, your system shifts into restoration mode. That's why I tell my patients, if you want your body to heal and perform like it used to, give it what it needs when it's most ready to receive it. So here's the rule I give every man who walks into my clinic: take vitamin D3 and K2 with your final meal of the day, ideally within an hour before bed. That meal should include a healthy fat source such as eggs, olive oil, avocados, or a handful of almonds. Fat helps carry these vitamins through your digestive system and allows them to be absorbed efficiently. Without fat, they pass through your system like rain on stone, barely touching the surface. A glass of water before bed is also key. It keeps your circulation active during the night and supports the delicate endothelial tissue that lines your arteries. And here's something that surprises many men: alcohol before bed can undo the benefits of these vitamins. Even small amounts of alcohol lower testosterone, dehydrate the body, and interrupt deep sleep cycles, the very moments your body needs to repair blood vessels and regulate nitric oxide. So if you're serious about restoring performance, swap the late-night drink for herbal tea or warm water. Within days, you'll notice that your mornings begin to feel different, clearer, stronger, more alive. Consistency is the secret. These vitamins don't work like a switch, they work like a seed. You plant them daily, and over a week or two, your body begins to change quietly from within. Most of my patients report the first noticeable improvement between day 7 and day 14. The earliest signs aren't even sexual. They're deeper sleep, fewer nighttime bathroom trips, and a sense of energy that returns in the morning. These are all indicators that your circulation and hormonal systems are waking up again. Then, gradually, morning erections begin to return. Not forced, not chemical, just natural. That's when men start realizing, my body isn't broken after all. Another thing I teach is the importance of pairing your supplement routine with simple lifestyle cues that amplify the effect. For instance, try exposing your body to 10 minutes of early morning sunlight each day. Natural light helps regulate your circadian rhythm and signals your body when to produce testosterone and when to absorb vitamin D. It's a simple, free step that enhances what you're already doing at night. Likewise, include magnesium-rich foods like spinach or pumpkin seeds in your diet. Magnesium works hand in hand with D3 and K2 to relax the smooth muscle tissue around your arteries, improving blood flow throughout the entire body. Men who follow this nighttime protocol often come back to me weeks later amazed. One patient, a 52-year-old engineer, told me, "Doc, it's like someone flipped the switch back on." But nothing was flipped, it was repaired. His body finally had the raw materials it needed to produce nitric oxide efficiently again. His blood pressure normalized, his sleep deepened, and his confidence returned without relying on any pills. That's the power of doing things at the right time, in the right way. Let's also talk about dosage, because that's where confusion often arises. Most men need around 2,000 to 4,000 international units of vitamin D3 per day, though some may require higher doses depending on blood levels and sunlight exposure. K2 is effective in much smaller quantities, usually between 100 and 200 micrograms daily. Always make sure it's the -7 Malawian Quatches form. That's the version your body retains the longest. You can find combined D3 plus K2 formulas that make it simple, one soft gel, once a day with dinner. And remember, supplements are meant to fill the gaps, not replace food. Eat real meals, stay hydrated, and your results will multiply. By the 3rd week, most men begin noticing a transformation they didn't think was possible. It's not just about stronger performance, it's about feeling alive in their own skin again. The body becomes warmer, circulation improves, and energy no longer crashes halfway through the day. Their partners notice the difference too: more energy, more attention, more connection. These changes are not psychological, they are physiological. When blood flow improves and hormone levels stabilize, confidence naturally follows. I always remind my patients that this process isn't a race. The goal isn't to force your body to perform, it's to retrain it to function the way it was designed. By giving it the right nutrients at the right time, you allow your arteries, nerves, and hormones to work together again in harmony. Every night becomes an opportunity for restoration, and every morning a reflection of progress. So tonight, instead of reaching for another quick fix or scrolling through miracle ads, do something different. Prepare your meal, take your vitamins with it, drink your water, and rest knowing that your body is already doing the work. The best medicine often isn't the one that forces, it's the one that rebuilds. And when you learn to work with your biology, you'll realize that your best years aren't behind you. They're waiting just ahead. Over the years, I've seen hundreds of men walk into my office carrying the same heavy look, the look of frustration mixed with quiet embarrassment. They tell me they've tried everything from herbal tonics to little blue pills, and yet nothing feels real or lasting. Most of them whisper their words as if their struggle is something to be ashamed of. But I always remind them of one thing. What they're facing isn't a moral failure or a lack of manhood, it's chemistry. Your body is a living system that runs on balance, and when that balance is disrupted, everything from blood flow to mood begins to fade. Once you restore it, everything changes. I've seen this transformation in men from every walk of life. Truck drivers who spend long nights on the road, office workers who sit for 10 hours a day, retired veterans who believed their best years were behind them. All of them share one thing in common. They thought it was over, but it wasn't. Their problem was never desire. It was deficiency. Their arteries were stiff, their hormones were sluggish, and their nerves weren't firing efficiently. But once they began restoring their vitamin D3 and K2 levels, it was as if the lights slowly came back on. The first thing most of them notice is not even sexual, it's energy. They wake up feeling alert, clear-headed, and strong. Their mood stabilizes, their patience returns, and they stop needing that second cup of coffee to get through the morning. Within a few weeks, they start sleeping deeper and waking up refreshed. Then something remarkable happens. The body begins to remind them what vitality feels like. Circulation improves, blood pressure normalizes, and the brain starts receiving more oxygen. And yes, their natural performance follows. Morning erections return, endurance improves, and the sense of masculinity they thought was gone begins to rise again, naturally, not chemically. As a doctor, I've witnessed tears of relief from men who had lost all hope. One patient in his 50s once told me, "Doc, I feel like myself again." Another, a retired soldier, said, "I didn't realize how much of my life I had given up to fatigue." These are not isolated stories. They are what happens when you treat the cause instead of the symptom. When blood flow improves, everything improves: your mind, your heart, your confidence. You start thinking sharper, moving easier, and living better. Because better circulation means better oxygen, better hormones, and better healing. That's the beauty of this approach. It doesn't just change one part of your body, it revives the entire system. Vitamin D3 and K2 don't mask the problem. They rebuild what time, stress, and lifestyle have quietly taken away. This is why I tell every man I treat, don't chase stimulation, chase restoration. You don't need more pills to force an effect. You need to support your biology so it can perform on its own. When your arteries are healthy, your blood flow is smooth, and your hormones are in balance, your body remembers how to function like it was designed to. And here's the truth every man should hear. You're not broken. You're not past your prime. You're simply running on an empty tank. The male body is resilient. It's built to recover, to rebuild, to adapt. All it needs is the right fuel. By feeding it with the nutrients it truly depends on, you reignite the natural chemistry that makes you feel alive again. So if you're struggling, don't feel shame. Feel curiosity. Ask yourself what your body has been missing. Because in my experience, once you start restoring what's missing, you don't just get your performance back. You get your life back. That's the quiet truth behind every real recovery story I've seen in my practice.